The fastest growing programs in behavioral health aren't trying to serve everyone. Welcome back to Mastermind. I'm your host, Mark Scrivner, and as always, joined by my co-host, Jeff Skillen. Jeff, how you doing today?
I'm doing great. Looking forward to today's episode.
Yeah, man. Well, hey, listen, I started something back again. I was missing a fitting on my cold plunge tank, and so it came in through Amazon, and got it back in and started cold plunging every day this week for 5 minutes, and it has been extraordinary.
So what do you notice?
You know, it's calming. I have more energy, more focus, and it's just after 3 days. I did notice, though, the first day of getting into it is how painful it is to start something over again, where in the past, when I was doing it, it was so much easier to step foot in that now, but I'm getting that Teflon back on.
Any new habit, the start is the hardest part, for sure.
Well, hey, trauma-focused care, tech addiction, gambling, youth, adult tracks, niche populations with highly tailored models, and the results speak for themselves. Stronger positioning, better outcomes, and more consistent admissions. Today, we're talking about specialty programs that are winning and what that means for the future of this industry. Thank you for joining us, Jeff. We're going to kick this off. Talk a little bit about, do I niche or do I continue to be a broad program out there? What are you seeing?
There's a couple of different ways that I want to approach it, but before we jump into what should I do, I think we ought to start with this premise of, in healthcare, for the longest time, people thought, programs thought, organizations thought that bigger is better. That the idea was that if we serve more people and we just get bigger, then we're going to get better outcomes and so on and so forth. Well, I mean, what I think people have realized is that, people want to receive care from people who understand them and understand their specific situation. So it's really important that you can address what it is that people are seeking from, that niche perspective. Do you have specialists that can address each of those angles? So the way that I would explain it is like this. So just go on a journey with me for just a moment. Okay. Let's take it out of healthcare. Let's say I'm a guitar player. Okay. There are millions of guitar players out there. And so then there's opportunity to serve those millions of guitar players. That's amazing. But what if I'm a left-handed guitar player? What if I had an opportunity to actually seek services or seek mentorship or seek, lessons from someone who is also a left-handed guitarist? Don't you think I'd be more likely to go seek services from somebody, if I had a choice, somebody who actually understands me, understands my situation, and can offer me specific guidance? Don't you think that's going to get the nod over somebody that's just more of a general situation? Mm-hmm. That's what people are looking for when it comes to behavioral health care also, because healthcare is personal. It boils down to everyone's situation is unique to them and unique to their situation. They want to work with someone who, quote, gets me, and not just, I don't want to be lumped into, I've got the same thing that a million other people have. So you need to make sure that you offer something that make people feel like you understand them and that they're special.
Jeff, that's a great perspective, especially the left-handed guitarist. And it's really no different in any industry. Like, you think of even your role of fractional CMO out there helping behavioral health companies. And I know in the past I've asked you, hey, could you help me out with this other industry? And you've said, hey, man, no, I think I'm better suited over here. And for us, Snapshot, as an agency that focuses primarily on behavioral health programs, it's like we have found that niching down is very important to the growth of the business. And there's no doubt that these specialty niche programs are growing faster than the generalist.
Well, I love general knowledge, and I mean I'm a big fan of that. But when it comes to that, will only take you so far. Mm-hmm. If you want to continue to get better and stronger and deeper in an area, and frankly more profitable in an area, you really should focus on specialization. I think that's critically important. And let's just take a look at it from sort of a macroeconomic viewpoint of like what's happening in the larger economy and then the larger society. Take a look at restaurants. Mark, you came up in the restaurant industry, right? Who are the segments that are hurting the most right now when it comes to restaurants?
Yeah, the generalist.
The people who are in the middle.
They serve everybody.
Right. So what advice would you give somebody into that segment? I mean, you should specialize, right? Why is it that healthcare is late to this equation, especially behavioral healthcare? So I see this as a tremendous opportunity to recognize that it's like, even if you do have a large program that's built upon serving larger populations, that means that you could have specialty tracks. That means that you could have specialty you can specialize your clinical care to address those special diagnoses and things like that, but you need to have a solution for this.
Yeah. Jeff, is it you think it's driven more by like the patient or competitive pressure or like referral sources? Like which one of them are driving it more?
So D, all the above.
All the above.
I do believe that it starts with the patient, though. And what it boils down to is, I mean, it wasn't that long ago in our industry where there was such a stigma about coming forward with addiction issues or coming forward with mental health issues. I'm grateful to say that in the last decade or more, that stigma, while still present, has reduced dramatically. And so as people come forward and say, I know that I need help with a certain issue, they want help and they want services that specifically are tailored to what they're experiencing. So I do believe that a lot of this is being driven by the patient because they're saying, you know what, I'm raising my hand, I need help, I need support, but I want someone who understands me.
Yeah. We've talked about it on past episodes about branding. And I guess, as you think about like from a branding perspective, like, why does niching down? Why is it so important? And then how do we brand this to get it out into the marketplace?
All right. I've said this before, and I'm going to continue to say it because I think it's really important. When it comes to branding and the equation that works is don't be the best, be the only. And what I'm going for here is like I want to be the only program known for fill in the blank. And you can slice this a couple of different ways. We can slice this from a population that you serve. I serve adolescents. I serve the geriatric population. I serve young adults. You can slice it from a diagnosis. I focus on mental health. We focus on OCD. And then the third slice that you can take of this is geography. Focused on, I want to be the best. I want to be the only in my zip code. I want to be the only in my state. I want to be the only in my region. I want to be the only in the country. So obviously, the larger you zoom out, the more challenging this becomes. But we can point fingers and we can indicate programs that have done this well. Where it's like, take the Cleveland Clinic for example. When I say Cleveland Clinic, what comes to mind?
Very best, top notch. Like
for what? For
cancer. For heart care.
The thing when I think of Cleveland Clinic, the first thing that comes to mind is cardiac care.
Yeah,
is for and so if I were in a situation like that, I've already got in my mind who is the only that I want to go to. That's the opportunity, and also, frankly, the challenge of how do I develop that for myself? Well, it starts off by saying, again, go through those three steps, and you start to get a picture of what you want to become, quote, the only in.
Yeah, and I guess when you are the only, it makes it so much easier from a referral source standpoint.
Absolutely.
Yeah.
Those referrals, although I'm going to self-correct myself, I was going to say those referrals may not be as plentiful, but that may not be true. I guarantee, regardless of the volume of referrals, they will be spot on for what you provide.
Yeah.
And so it's like when people really understand what you have to offer, and it's really clear that you're the best and you're the only option, then virtually all the referrals and all the leads that get generated will be a perfect fit for your program. And then it's just a matter of just turning up the volume for that.
Yeah. So speaking of that and staying on this track, So we've decided we're going to niche. We've trained the team. We've got the best. We're ready to go. We are the one out there that does this. Like, how does a program go about like getting the word out to referral sources, to the just to the broader like state, the city, the wherever they're targeting?
Well, here's what we say we do, and then here's what we actually do. And you need to make sure that those things are in unison. So let's just hypothetically say that, Mark, we're going to start a program tomorrow, and we're going to focus on the geriatric community. And we chose the geriatric community because we know that that is a population segment that's continuing to grow. And we know that that is a segment that probably doesn't get the same amount of attention and services as, say, adolescent or young adult or things like that. So we've decided that that's where we're gonna focus. Great, growing segment. How are we going to support that? Do we have clinicians that are trained to focus on the geriatric community? Okay, let's say that we've got that. Are our facilities built out to support the needs that come with the geriatric community, which tends to come with more comorbid things, like they may have mobility issues, they may have other medical issues that are going on that we need to make sure that those are addressed or can be addressed safely. If we do all of those things and can support that population, now we create content or messages or stories that indicate that we're the best at treating that. And, we get our clinicians to talk about it. We get the people that we serve to give us testimonials, and we get the word out that just further puts a halo on the story that we've created.
Yeah. How do you think that changes the tone and the effectiveness of like the admissions team, of intaking these calls?
It's a lot easier to guide somebody into your program that's already 80% of the way a fit, as opposed to somebody who's 40% of the way a fit. And you're trying to then, either convince or, modulate their position or recognize that it's not a good fit. So it's like, the more square pegs you can put into the square hole, the easier that admissions job is going to be every time.
Yeah. Well, let's say now we've decided we're building this all out. Well, what does it look like to build out a specialty program? Like, I know you've done it for, some of your clients, and we've worked with, like, how do we get the message out? But, like, how do you start to think about, I'm going to build this out in a treatment program?
A lot of times programs come to this recognizing that they've been in a market for a while, and they recognize that they do need to niche down. And so one of the first questions that I'll ask is, can we accomplish this creating a track or creating a segment of your business, or are we looking at a wholesale shift of your entire operation? A lot of that times that comes down to size and scale. Right? Because if you're a 12 to 20 bed operation, you can pivot a population fairly easily. But if you've got a 100 bed operation, that's going to be a lot more challenging to then try to niche. So you're looking at that point having multiple different tracks or niches that you want to be able to serve.
How about that's a great point. What separates the programs that actually are truly niche down versus the ones that just say they are niche down? Like they may say we're good, we're the best at this, or we're good at it. Nobody's going to say they're not the best. But what's the thing that separates the ones that truly are?
Well, you can always kind of tell the programs that are sort of virtue signaling towards let's take a specific diagnosis, for example. Let's take OCD as an example. There are a handful of programs that I would feel very confident referring people to for OCD. There are others that put it on their website. They say that they provide it, but it's pretty clear that that's not something that they really deeply specialize in. You can always kind of tell when people are just keyword stuffing, or they're trying to put a popular diagnosis out there in order to then attract that population, as opposed to, deeply understand it. Okay. So that comes from referral relationships, that comes from reputation, that comes from reviews, and it also comes from the type of content that they put out. So if you've got a clinician who's well known in the industry, whether locally, state level, regionally, nationally, that focuses on providing care for OCD, you'll know. You'll know because you can go to their LinkedIn. You can go do a little bit of research on who that clinician is, and you'll see. Oh no, this is the real deal.
Yeah. Well, here's a question that I'm sure every CEO and CFO are going to want to know about. But like, how does niching down affect the cost per admit?
Theoretically, if you've done this work well and you've identified your niche well, the cost per acquisition for that client should actually decrease. And the reason for that is that you're able to be much more hyper-focused, hyper-targeted on the persona that you're trying to attract, and your content will be much more on point, much more aimed at that population, and you're probably going to get more organic clicks, direct visits to your website because you're focusing, on a specific population as opposed to a much broader net that you have to cast. I guess if I had to boil it down to a simple point, it's like casting a broad net is expensive. Going after sort of a laser focused approach is a lot more economical.
Yeah. And, as I'm sure most, founders, CEOs, operators that have built programs, I mean, they've built it with multiple service lines that they're offering. And I guess, what you've seen it where we've got to niche down to be the very best in one of these 2 or 3 that we're offering.
Right.
Like, what kind of mindset shift do you think it takes to be able to do that and know that, hey, I'm passionate about these others, but this is going to help drive the experience for our patients, going to help, drive the company? What
I find working with programs, there tends to be a lot of relief and a lot of people who are like, wow, we are understanding who we can really serve the best, and it brings focus to an organization. I mean, it brings focus to a clinical team, an operations team, a marketing team, an admissions team. When they're like, okay, we've decided this is who we are and this is what we're going for. The biggest shift is usually at the owner level or at the C-suite level that just said, where they make the decision that says we're doing this and we're going to accept the economic realities of doing this and recognize, this is going to, move us in a certain direction one way or the other, and we're going to be fine with it. Once you've made that decision and it's communicated to the team, what I find is that it's focusing and people actually feel, really, enthusiastic about it.
Yeah. What I'm sure I know the answer to this, but like, what do you see as being a big leadership mistake when we've decided we're going to make this change, we're going to pivot, we're going to get focused, it's going to make our lives easier, it's going to make us provide better care? What leadership mistakes do you see?
The biggest challenge that I see with people is that they struggle to change the business model that has worked in the past. And so the business model that may have worked for them in the past, and that could be 1 year, 5 years, 10 years, 20 years of sort of a broad marketing strategy, they need to recognize that, sometimes you need to shift and sometimes you need to make the change. And that niche is tough when something has worked well for you in the past. So it's like that strategy, is difficult for people to and can be costly if people continue to try to force the old model into a new reality.
Yeah. Well, as we start to get towards the end of the episode, what's one hard truth about specializing that maybe behavioral health leaders don't foresee?
I don't think people always take a step back to realize all of the various options where, the various options that they have. They tend to stay rooted in where they've been as opposed to where the market is going. And then the other thing that, that I need to bring up is there's also level of care specialization also. So like the outpatient level of care, the IOP level of care, the PHP level of care, residential. And it's like that gives you yet another level where you can specialize in terms of wanting to be the only, as opposed to being the best, being the only. So there are so many layers and levels. I would recommend that you reach out to somebody to help you decipher some of these things, so that if you're unclear about whether your marketing strategy, there's a mismatch between your marketing strategy and the clients that you're attracting, maybe it's time to do a market survey. Maybe it's time to take a fresh look at where can we specialize, where can we potentially offer a niche service, and what would that look like? There are professionals out there that can help you make that pivot. And even if you ultimately decide that you don't want to do that, or if you do want to do a segment of that, at least you're armed with the information and the data to make that decision.
Yeah. Is there an organization that you go to, or who is it? Just individuals that help programs through this? Like, what do you see?
There are consultants like myself that can help you do this. There are data. There are data organizations that have this information. And then, listen, doing research these days is changing dramatically as it pertains to AI and machine learning and things like that. There are lots of things that you can do to then think differently about this conversation.
Well, if a program wants to start to niche down tomorrow, like, what's the first step? Is it that research? What is the first step I need to take?
I think the first step that you would want to take is what a lot of programs already have a sense for where they should go, but they're maybe seeking that validation. And that's where I would reach out to an expert to help you do a market analysis, and then decide hey, is our instinct right? Or do we need to be looking at additional options? I do think that most people have a feeling, they have something in their gut already, but they need validation before they act on it.
What is a niche that you're seeing today that's becoming really hot in this market?
Okay, so here's an example. I'll give you two examples. One, there's tremendous growth in the autism sector. Tremendous growth in that area because there's a lot more diagnoses and there's a lot better understanding of neurodiversity, neurodivergent thinking. And that segment is a really strong one if you want to get into it. Another one, if you're already in the mental health or behavioral space and you want to add sort of another track, that's gambling. And if you think about it from a sort of a process addiction standpoint, these gambling platforms are proliferating like crazy. It's like you can't watch a sporting event without there being an opportunity for you to gamble. And then there's also Polymarket and Kashi and all of the various opportunities for you to wager on things. So this is going to continue to grow and likely explode from a standpoint of people wagering and losing. And so I think there's a tremendous opportunity. So that being said, we know that segment is going to continue to grow. Geriatric is going to continue to grow, right? Because that's where the population is going. So, but the point being, it's one thing to recognize that trend. It's another thing to say, am I training my staff to actually focus on this? And if I am, then can I shift my marketing message and my marketing focus to then attract those people to the clinical expertise that I've already built?
Yeah, the gambling, that's interesting. And we are hearing more and more about that these days. But even, as you were saying that, it's not even as much just gambling on games or, the poly markets. It's even on investing, with all the online trading platforms. You see younger people now, investing and losing a lot of money on that. And so there's gambling comes in a lot of different spaces.
Well, if you go to Polymarket, it's fun to do, but it's wild what people will put up there. Yeah. It's will LeBron James sneeze tonight or will it, obviously making that up, but it could be literally anything, and it's whatever people latch onto.
Yeah, Jeff, is there anything that maybe we didn't talk about or I didn't ask you?
Well, I'm a big believer, Mark, as you know, that in my opinion, the riches are in the niches, and that's not to say that large programs can't support these niches, but they do need to have a strategy for them.
Yeah, and if I'm a program that has other tracks, but I want to really niche down into this one, is it you have to have a leader that sits over the top of it to really build this thing out, or
you need to have credible expertise in that space in order to get your share of the thought leadership for sure. Somebody that, for example, can go on the conference circuit and do keynotes and then shine a light on your program as, again, the only program you should be considering for this, for this client.
Yeah. Well, Jeff, man, great episode. Great job on all the niching down. Really appreciate all your information and insight on this. So that's a wrap on today's episode. On behalf of myself, Jeff, and the entire Mastermind crew, thank you for tuning in today. If you would, please rate, review, and subscribe to all of our channels so that we can get our message out to more people. Thanks again for tuning in, and until next week, we'll see you then.
That wraps up this episode of Mastermind. Thank you so much for joining us. And remember, Mastermind is not just a podcast, it's a community. So don't forget to comment, subscribe, and review us. Your feedback helps us continue to bring you content that's relevant and relatable. Thanks again to our sponsor, Snapshot, a digital media marketing agency. And thank you for joining us on Mastermind, your behavioral health playbook.